What your orthopedic doctor isn't telling you. Hi, I'm Dr. Justin Lin, Doctor of Physical Therapy at Rehab and Revive, and we're going to dive into those missing details right now. Before we start, this is not surgeon bashing. I love orthopedic surgeons. They are highly skilled technicians. When something is torn, broken, or shredded, they are the master carpenters of the human body. But here's the reality. Their job is to fix the structure. Your job and my job is to restore the function. Sometimes the in-between details get missed. So here are the 5 things you aren't told clearly enough after surgery. 1. Schedule your PT before surgery, not after. This one blows my mind. People schedule their surgery weeks in advance, but don't schedule physical therapy until they're already swollen, stiff, and panicking. Research shows that early rehab improves outcomes in joint replacements and ligament surgeries. Better yet, do prehab. Stronger muscles going into surgery equal better outcomes coming out. You wouldn't run a marathon without training. Why would you go through surgery without preparing? Ask your surgeon's office, when should I begin PT? Can we schedule now? 2. Swelling is not just normal, it's a system. Surgery creates trauma, and trauma creates swelling. But here's the part that gets missed. Swelling inhibits muscle activation. This is called arthrogenic muscle inhibition. It means your quad or your glute literally shuts down because the swelling is drowning the joint. Lymphatic drainage, elevation, and diaphragmatic breathing aren't fluffy spa treatments. They are physiology. Early edema control improves your range of motion and decreases pain. Swelling control isn't optional, it's foundational. 3. Have a clear medication exit strategy. You'll likely be discharged with a cocktail of pain meds, anti-inflammatories, or nerve medications. But often, patients aren't given a clear taper plan. Opioids can cause brain fog and dependency, while NSAIDs, non-steroidal anti-inflammatory drugs, can irritate the stomach if overused. Don't assume. Ask, how long do you expect me to take this? And when do I begin tapering? Pain is expected after surgery, but medication side effects spiraling out of control are not. 4. Know what's normal and what's an emergency. This is where anxiety skyrockets. You hear a pop, you feel a crack, or something clicks, and you think the surgery failed. After surgery, scar tissue forms and gas bubbles shift. Small creaks and pops are usually just mechanical adjustments. It's normal to feel mild swelling for weeks, bruising and morning stiffness, small, non-painful quickening. But call your surgeon immediately if you have a fever over 101.5 degrees Fahrenheit, redness spreading rapidly, calf pain with a warmth could be a sign of a blood clot, shortness of breath, that is ER territory. 5. Surgery is the starting line, not the finish line. Some patients think, I had the surgery, it's fixed. No, it's structurally repaired, but the function still needs to be rebuilt. Muscle atrophy begins within days of surgery. If you don't intentionally rebuild strength and balance, your body will compensate, which leads to other joint issues down the road. Ask, what are my 3-month goals? And when can I safely return to my favorite sports? Be proactive. You can get a perfectly installed knee replacement and still walk poorly if you don't retrain the nervous system. Here's the big picture. Your surgeon is focused on the precision inside the joint. Your physical therapist is focused on how your whole system works afterward. It's a team, but you are the captain of that team. Schedule early, control the swelling, and commit to the full rehab. That's how you protect your investment. If this helped clarify things for you, leave us some love or questions in the comments below. Please like and subscribe. We truly appreciate your support. I'm Dr. Justin Lin, and remember, we heal smarter.